This will be a 6-minute speech. You may begin when you're ready.
Be it resolved that there are problems with the private health care we use here in America today. It is expensive, so people with less money are unable to obtain the care that they need. If someone gets hurt, they need help whether they can afford it or not. If they cannot, they are in debt for a large portion of their life. With universal health care, people will be able to get the care they need and be able to afford it. Health care is health insurance, which often pays for medical and surgical expenses for the people who are insured. They will either reimburse you or pay the care provider directly. In shorter words, it is any kind of insurance that helps you pay medical bills. It is important to have, even though you can live without it. If you suddenly break a leg or have a heart attack and need to go to the hospital right away, you'll be faced with a huge bill. Without insurance, you have to pay it all. These bills can be hundreds of thousands of dollars. There are not many people out there who can pay that all at once. There was a woman in Ohio named Trina Batchel who was pregnant and had health problems, but did not have health insurance. The clinic would not see her unless she paid $100, which she could not afford. Eventually, she sought to receive care at a hospital 30 miles away, but it was too late. Both the woman and her baby had soon died. Private health care is any health care that is not provided by the government, but by the company you work for. Some people don't receive this kind of benefit, however. Without this, you're basically paying out of pocket, so only the rich can afford help, while the poor are out of luck. Some people aren't even accepted to have this care. If you have some kind of medical condition, some companies won't even consider giving you the care you need to have a happy life. Each person pays $7,960 per year on health insurance. Universal health care is health insurance that the government pays for using taxes. Everyone pays for everyone else's health care, and it is a very fair and not prejudicial system. Taxes may seem terrible, but in the long run, you may be paying less than you would otherwise. Even if you're some kind of superhuman who can't get hurt or sick, you're still helping people who really need care by paying your taxes. Healthcare systems should be honest. In other words, they should be true to their word. Sometimes companies will leave out important details or not explain the fine print. Some companies will suddenly stop supporting you for no apparent reason. There was a 14-year-old girl named Natalie Sarkisian who had leukemia and needed a bone marrow transplant. However, her health insurance company would not let her get one right away. A few years later, when the girl was 17, they actually decided to give her the care she needed. But unfortunately, just hours after they did, the girl had died. We have many reasons for change. Our current system is expensive, so not everyone can afford it. 47 million Americans are uninsured. Countries with universal health care have longer life expectancies. Coincidence? I think not. Some people think it will ruin our economy, but some successful countries, such as Canada, have it. Private health care is also very dishonest, not explaining the fine print and refusing care to people who need it. If you can't pay, you will be in debt. Debt is a curse, and while universal health care will not completely get rid of it, it will provide a great help. We plan to change America's out-of-pocket method to be completely universal. Taxes will be increased, but it will still cost less than out-of-pocket in the long run. We will close loopholes so people don't try and dodge your taxes. We will make it available to every legal citizen. This program will pay for itself by cutting unnecessary costs and expenditures and adding new sources of income, such as cutting unnecessarily expensive tests and small tax breaks for companies that donate state-of-the-art equipment, and cutting the outrageous amount of money that specialized doctors make. This may sound kind of mean, but the average anesthesiologist makes $337,000 on average per year. It is illegal for hospitals to refuse care to anyone, even if they do not have insurance. However, they still have to pay later on, putting them in debt. People in debt are less able to afford food and other daily necessities. Healthy people who take care of themselves will have to pay for people who smoke, do drugs, etc., but those people will have to pay too. We are also helping people who have conditions that they can't help as well. There may be a long transition period that would have to be made, including the closure of companies. However, it would be better not to put it off. If we start sooner, it will end sooner. If we start later, it will end later. If we never create universal health care, then our country will gradually become less and less healthy and more poor. It's like a homework assignment. If you do it now, then it's over with. If you put it off till the end, then it's all going to pile up and you're going to be very stressed. If you never do your homework, you're just going to fail altogether. Both the affirmative and the negative teams want to make America greater, and we believe that this is the way to do it. Universal health care is much less expensive and helps more people than private health care. I will now stand for cross-examination.
Negative team, you have 4 minutes for your cross-examination. You may begin when you are ready.
Do you know that what the homicidal, accidental, and otherwise unnatural death rates are in America? No. Well, by our investigations, they're extremely high, according to the CIA Act Book. And do you agree that these would affect the life expectancies in America?
Yes.
Well, we have found that they do. In fact, studies that take this into account rank America as having the third highest life expectancy rate in the world. Do you agree that another major factor in life expectancy rates is frequency of illness?
Yes.
Well, we have found that America has one of the highest frequencies of cancer, heart disease, and especially obesity, making us rather unhealthy. Do you agree that this may be, that healthcare is not responsible for these diseases, seeing as they are hereditary and result from lifestyle choices? Yes. So we can assume that healthcare is not responsible for this?
Yes.
All right. And that also would reduce life expectancy rates greatly. Being a person in need of critical life-saving care, would you feel appreciative of or privileged to possess a system that said you could not receive such care for several weeks, months, or even years past the date for effective care?
No.
Well, if you were a person in that situation, being in need of critical care, such as a transplant, would you consider the black market as a means to save your life?
Yes.
Well, so do many people in countries with universal health care. In fact, the high demand on the black market by both patients and doctors has given them extremely high black market trafficking rates, some of the highest in the world, in fact. Were you aware of that fact?
No.
You also mentioned that people were denied care because they did not have insurance, but then you later mentioned that people could not be denied care regardless of whether they could pay for it or not. Do you not agree that this is a contradiction?
I do agree that that is a contradiction.
Are you also aware that in France, people have to pay 21% of their tax, 21% alone of their taxes goes just to medical care?
No.
And that, no, it wasn't 21% of their taxes actually, it was 21% taxes just for medical care. And so, were you aware of that?
I was not.
The cross-rests. Thank you.
We'll now begin the first negative constructive speech. This is a 6-minute speech. Please begin when you are ready.
Honorable judges, worthy opponents, ladies and gentlemen, we, the negative, challenge the affirmative definition of the resolution, which is designed to give the affirmative team an unfair advantage. We urge the judges to accept our more reasonable definition. We define our resolution as such. Be it resolved that we have found sufficient evidence to prove that universal health care is a flawed system and should not be implemented upon the United States. We, the negative, define the terms frivolous as of little or no weight, worthy or importance, not worthy of serious notice. Health as the condition of being sound in body, mind, or spirit, especially freedom from physical disease or pain. We define universal health care as universal health care is a system that provides organized health coverage to all citizens of a governed region and is publicly funded through taxation. The healthcare systems under universal health care are built upon the principle of universal coverage for all members of society by combining mechanisms for health financing or service provision. Apart from the definitions, the negative team is unable to accept the contentions put forward by the affirmative. I will now refute them. The affirmative had 10 needs for change. Their points are wrong because the affirmative team did not account for the fact that universal health care would cut important programs, raise taxes so much that many people cannot afford it, and many countries have already failed with the system. The negative case has 6 contentions. My partner will now continue with the reason.
We the Negative Constructive argues that the inclusion of universal health care as a government program would be a disadvantage to the U.S. rather than a benefit. The Affirmative Constructive argued that the current health system is failing and universal health care would provide a better system that would provide care to all Americans. We strongly disagree with this point and believe that the current system is the better option. My first contention is that one of the reasons that universal health care is considered superior is that it's free and available to every citizen of the U.S. However, it is not as free as it seems. Taxation on the middle class would rise, and severe cuts would be made to important government programs such as education and the military. For example, in France, the working class per se individual pays 21% of government-funded health care. Also, the current system promotes competition between doctors that reduces costs and creates a stable medical economy. If hospitals were run by the government, salaries would be lessened and the incentive for doctors to work and pursue research would be decreased. This leads into my second contention, that the current system appears to favor people who can afford expensive care and leaves lower and middle classes behind. Universal health care appears to be the cure for this, but the opposite is true. Just because all citizens are admitted does not mean that only the suffering will go to receive care. Because there are no regulations means that some of the mildly sickly will go to receive care that the ones who really need it will not get. For example, physicians in Quebec believe that since the introduction of Medicare, frivolous patient complaints rose by 75%. The rich can also choose private practice, which shows that favoritism for the rich will not change, but only grow stronger. This leads into my third and final contention, that one of the primary incentives for people for the U.S. to receive universal health care is that other countries have had it for a long time. On the surface, it looks like they have succeeded, and they have to a degree. Foreign hospitals are plagued with out-of-date equipment and less available procedures than the U.S. Their lack of regulations creates overcrowded facilities and causes patients to be pushed onto long waiting lists. Even when patients do receive care, it is rationed and limited. All this proves that if the U.S. received universal health care, it would end up with a plethora of problems that would overpower the benefits. My partner will continue with the conclusion of our argument.
My partner has begun the negative speech by clashing with the affirmative and by making three strong points for the negative. The universal health care would not be beneficial to the United States, and it would be bad for doctors and patients alike. It would also burden the middle class with unnecessary taxes. The many countries who have implemented universal health care have failed to become superior in healthcare than the United States privatized system. And although universal healthcare promises a more balanced society, the quality and availability of care would actually go down. Furthermore, those who do not pay taxes would receive healthcare for free. A quote from United States Representative John Campbell: "No one in a free society should have a right to anything that requires others to toil against their will on behalf of those unwilling to provide for themselves." End quote. I'm sure the judges agree that their case must fall. I now call upon my colleague to be in the negative to be cross-examined.
Affirmative team, you have 4 minutes for this cross-examination.
Before I begin, let me state to the judges, audience, and the worthy opponents of myself that the following questions are yes and no questions only. Let me begin. The cost for private health insurance varies, correct?
Yes.
It is also possible that some private health insurance companies may have possibly misled people into thinking that they have less expensive coverage that's just as good as their competitors, correct?
Absolutely.
So people could possibly be roped into bad deals by misleading companies and gain little to no insurance for their ordeal. Do you agree?
Absolutely.
These same customers might then get hurt and desperately need the health insurance that they thought they were paying for, but their health insurance company had a clause that kept them from having to pay. That was also written in extremely fine print that would be nearly impossible to read. Do you think that that's fair?
Not particularly.
Under this light, do you think we should control this system of healthcare so that this doesn't happen to our friends and family?
No.
So we should leave our lesser paid, hard-working brethren out in the storm, so to speak.
Not at all.
Universal health care would cover all the hard-working citizens who can't afford the coverage they need so that they don't have to live in the threat of losing all that they own to pay for huge debt or being dropped. Do you agree that not living in the fear of being dropped by your insurance company is good?
Yes.
Then you agree to one of the most major measures of universal health care, removing fine print contracts from this industry. The cross-examination rests its case.
Affirmative team, you have 6 minutes for your second constructive speech.
This is for you guys. Like my partner Ms. Benham stated previously, we believe that America's healthcare system should be honest. A health insurance company should state what they need and not have fine print that many people do not look at or do not even see. No details should be left out and everything should be easy to understand. No company should stop supporting anyone for no valid reason. We also believe that the system should be fair. Fair meaning everyone is treated the same. Universal health care is fair in the way that everyone pays the same amount of money for health coverage. In an article called The Healthcare System and the Many Loopholes, it talks about a woman with breast cancer and her private health care insurance. To be true to the article's words, I will read it off. It was when she, Tracy Ryan, had to pay a sum of $17,000 on her that she realized the authenticity of the healthcare system. She was shocked to see that no sort of help came from her private health cover. This was despite having the best of the line health insurance covers for her medical needs. It was revealed they have had to pay a sum total of $10,000 from their own pocket for the other medical bills that were issued to them. If the United States had universal health care, then Ms. Ryan would not have had to pay so much out of her own pocket. Taxpayers would have at least helped. The current healthcare system in the United States is highly expensive and most people cannot afford it. Most people cannot pay $10,000 right out of their pocket, at least not right away. With universal health care, everyone's small amount of tax will build up and be able to pay for others, such as Ms. Ryan will be taken care of. If someone needed care but could not afford it, then they would not receive the care that they needed. However, it could be argued that they could still get the coverage, but the problem then would be debt. Coverage is available to those who can afford it, but it would still be needed to be paid off somehow. If they could not pay it off right away, they would be in debt. Debt affects their daily lives with how much money they have for everyday necessities, such as food. And it is possible to pay off this debt, however, realistically, it would take a while. If they chose not to pay instead of being in debt, then they would not receive the care. Their condition could easily stay the same, get worse, or even become fatal. With universal health care, everyone will pay for everyone, and the coverage will have no costly payment and no debt. Yes, there will be a new tax. However, no one will have to pay thousands of dollars just to get the care that they need. This is especially good for the lower and middle classes who sometimes cannot afford to have the care they need. Some might believe that with everyone paying new tax, the poor might not be able to handle it, and health rates would go down. However, this is not the case. Countries with universal health care actually have a higher life expectancy rate than those who do not. Some examples of this would be Hong Kong with 82.2 years, Japan with 81.5 years, Australia with 80.1 years, Canada with 79.5 years, and the United Kingdom with 77.7 years. Each of these countries have universal health care and a higher life expectancy rate than those who do not, such as the United States with 77.1 years, and Argentina with 75.3 years. That's a longer life that you get to live, and more time you get to spend with your loved ones. Wouldn't you want to spend just a little more time with those you love? Please refer to the handout I gave you previously. This graph actually proves my point. The darker purple line, it shows how much each country pays per capita. The United States being the highest, compared to Japan, who pays very little. The lighter colored bars is the average life expectancy of each of these countries. Ironically, the US being the lowest, and Japan being the highest. As you can see, Cuba actually has a very similar coverage to the US, however, pays significantly less. As I stated earlier, Japan has universal health care and the United States does not. This graph also proves that the United States is paying way too much for health care. I will now stand for the cross-examination.
Negative team, you have 4 minutes for your cross-examination.
Please accept the judges. So let me begin by saying that all questions, unless otherwise noted, are yes or no, or maybe. So after your death, would you like your organs donated?
Maybe.
Were you aware that the U.S. Has an opt-in system, which most universal healthcare countries frown upon? An opt-in system is essentially where you have to say, yes, I want my organs donated. Universal healthcare systems tend to have an opt-out system, where you have to say, no, I don't want my organs donated. However, the United States has a higher rate of organ donation per capita than any universal healthcare country. So, you raised the point that the U.S. spends much more on medical bills. However, you could probably say money too if we make compromises on technology. Do you know what the availability of medical technology is in British Columbia and other universal healthcare countries?
No.
Did you know that angioplasty is only available at one British Columbia hospital, while it's available at 80% of the facilities in Washington and Oregon? Were you aware that there are not any transplant facilities in British Columbia, and 50% of all hospitals in Oregon and Washington have them? Did you know that there was only 10% coronary artery bypass graft availability in British Columbia, and an 80% availability in Oregon and Washington?
No.
No? Do you think that medical innovation is important?
Yeah.
Yes? Did you know that it's an absolute fact that the United States alone has more medical Nobel Prizes than the rest of the world combined?
No.
No? Do you think that medical innovation has any effect on how much we spend on medicine? Maybe? Well, think about it. We have actually produced much of the life-saving technology, I shouldn't say all, that is used in other countries. So instead of that actual spending being used just in the US, it is then dissipated to the other countries, including universal healthcare countries. Do you feel that medical research freedom might be a contributing factor to the United States expenditures?
Yeah.
Yes? Were you aware that doctors come from Canada, Britain, and other universal healthcare countries for research?
Yeah.
You were? Why do you think that is, in one sentence or less?
I'm not exactly sure, but I've heard that the United States is more advanced
More advanced than the universal healthcare countries?
in researching.
And research. Okay, I would also like to point out that when you did your research on life expectancy rates, I'm going to once again repeat this. Did you take into account the rates of homicide, suicide, and otherwise unnatural deaths?
No.
Do you feel that that is a contributing factor? Were you aware that the U.S. is one of the highest rates of murder in the world?
I've heard that.
So it does absolutely have a contributing factor. Now, I would like you to realize that universal health care is universal. So do you feel that people who abuse drugs or overeat or are generally unhealthy deserve that kind of health care?
Yes.
Yes, so you feel that they should essentially leech tax money out of people who are hard workers and healthy eaters? Yes or no?
Well, do I answer
Yes
the
or no, please.
question? Yes.
Yes? All right. In that case, the cross rests.
Negative team, you will have 6 minutes for your second constructive speech. You may begin when you are ready.
Honorable judges, worthy opponents, ladies and gentlemen. The negative constructive defines the following terms. Fee-for-service as referring to the traditional form of reimbursement for healthcare services, where a fee is paid to a provider according to the service performed by a PT or a conventional indemnity insurer after a service is rendered. Availability as a percentage measure of the degrees to which machinery and equipment is in operable and commutable state at the point in time when it is needed. And finally, endocrinology as a branch of medicine concerned with the structure, function, and disorders of the endocrine glands. Apart from the definitions, the negative team is unable to accept the contentions put forward by the second affirmative. I will refute them now. The affirmative had 8 points. When the affirmative constructive said that with the current system, prices are too high and cause death. The fact is that with universal health care, people have to wait an absurdly long time for care, while now you can easily receive emergency care even if you have to pay for it. Also, the affirmative team said that companies are untruthful. However, with the current system, you can easily deal with doctors that deal with you personally. The negative team has 6 contentions. My partner will continue with 3 of them.
We, the negative constructive group, disagree with the affirmative and would like to put forth our contentions. The first evidence condemning the affirmative constructive's argument is the current state of the healthcare system in Canada. Supposedly, Canada has a working example of a universal healthcare system, but as of 2001, only 1 in 5 Canadians thought their healthcare system was working well. When the Canadian system is observed from the outside, it appears as a model for universal healthcare systems. But the patients and doctors are not the ones being asked the questions. According to khat.org, Canada has only 5.5 MRI units per million people, whereas in the United States we have 27 MRI units per million people. On top of that, it takes 21 weeks for orthopedic care, 18 weeks to get a heart bypass, and 16 weeks to see a neurosurgeon. Patients are not the only people suffering in universal healthcare systems. Doctors are paid low wages because of the fee-for-service method of payment, and this forces doctors to take in about 60 patients per day, which translates to about 1 patient every 8 minutes. This flawed system means that fewer students are aspiring to become doctors in these universal healthcare countries, and many of them come to the United States because of higher pay and better technology. In many other aspects, the United States system is favored over the Canadian one. Every year, 1 in 3 Canadian doctors send a patient to the United States. An example of this is Shauna Holmes, who crossed the border after she was told that she'd had to wait 4 months to see an endocrinologist and 6 months to see a neurologist. The source for this is fixedhealthcarepolicy.com. This is due to the fact that the United States has top life expectancy for many life-saving procedures, and the United States is also responsible for 80% of medical advancements in the last 30 years. My partner will continue with the conclusion of our argument.
has begun a negative case by clashing with the affirmative case and making 3 strong points for the negative. 1, that Canada is not an example of a universal healthcare system that works, but rather an example to other countries of how to avoid universal healthcare issues. Also, the citizens of Canada are not happy with their healthcare system provided by their government. Compared to the US, Canada has less access to medical equipment and has long waiting lines for care and for their operations. 2, that Canadian doctors are suppressed with their low wages due to that, and they're caused to give less attention to their patients. The number of doctors in Canada has decreased over the years due to more doctors coming to the US to find work. Number 3, the US healthcare system is more desirable compared to Canada's due to the fact that it has more advanced technology and higher survival rates. This is why patients come from other countries to America for life-saving care. 4, saying that a country has universal health care does not mean that it is succeeding. As John Mackey, Chief Executive of Whole Foods Market, says so well, even in countries like Canada and the UK, there is no intrinsic right to health care. Rather, citizens in these countries are told by government bureaucrats what healthcare treatments they can receive and when they're eligible to receive them. All countries with socialized medicine ration health care by forcing their citizens to wait in long lines for scarce treatments. Close quote. I'm sure that the judges will agree that their case must fall. I will now call forward my partner in the negative constructive to be cross-examined.
When you are ready, you will have 4 minutes for your cross-examination.
Ms. Simpson, I would like to give you some time to look over this graph while I address the judges. I would like to thank the honorable judges, the audience and family members, and worthy opponents for coming here tonight. I would also like to address the chart that I've given you, and the numbers on the graph are averages from 2008. I would also like to state that all questions are yes or no questions. I will now begin. In 2008, America paid $7,538 per capita for health care, correct?
Correct.
Is it true, on average, countries with universal health care pay nearly half as much for health care than America does, according to that graph?
According to this graph, yes.
In 2008, England paid $3,200 per capita for health care. Do you agree?
Yes.
In 2008, Japan paid $2,800 per capita for health care. Do you agree?
Yes.
In 2008, France paid $3,700 per capita for health care. Do you agree?
Apparently.
Those 3 countries, England, France, and Japan, all have universal health care, correct?
Correct.
Japan, the country in 2008, had an average life expectancy for both males and females combined of 83 years, while the highest in the world paid less than half as much per capita for health insurance than the U.S. did. Did it not?
For health insurance alone, yes.
France, the country with the highest rated health care in the world, pays less than $4,000 per capita for health care, correct?
Correct.
Is it reasonable the U.S. pays so much more, yet its service is not any better?
Yes.
So, just to confirm, you agree with my previous statement? Question.
I agree that it is reasonable that the American system spends more money on healthcare and medical innovation because we have more medical innovation. Sorry.
So are you saying that we should leave people of our own country, the United States of America, sick and without the ability or means to go to the doctor to get checked out? Okay, well, our universal health care plan, by lowering health care rates to make it more affordable for more people, will leave less people without care. Judges, audience, opposing team, I have no further questions.
All right, thank you, debaters from both teams. At this time, we will take a 10-minute recess. Rebuttal speeches will begin